You're coming from a different industry, and I'm sure we all are very much curious to know about behind the scenes. The HR person or a profession in healthcare is different from the other industries.
Actually, it is different because there is a lot of things we go through. We are actually not hiring people for their productivity. We are hiring people for clinical outcomes. Healthcare is a very highly regulated environment. You work under certain scope. This is what you have to get people. You have certain standards to meet. So when you have standards to meet, you have to follow the rules and regulations. Number one, I'm not saying other industries don't follow, but healthcare definitely has a regulated environment under which we function.
That this is going to be the best employee or one of the best selection for that organization. But unfortunately, that person completely failed. So what did that actually teach you about yourself?
Everyone comes out very good on the papers.
Right.
That's the first way of sourcing a candidate.
I think this is common in
Very
most of the
common.
industries.
Yes.
Yeah.
When they appear for the interview, their communication is fully articulated. They are very clear that this is what, okay, if I have to give an introduction about myself, this is what, since this position is for a nurse in critical care, this is what I have to answer. Okay, you do well in your competency assessment. I'm giving you an example of a nurse. So they do everything very well. But what happens is that it's just not the competency level. It is also about the speed, about your response time. So the C-suite level positions are very different from the managerial level, because then you really sink into the business and you understand the business and start working like the one. Be clear what you want to communicate, and before communicating, articulate your communication, because we play an important role. Although it is the most underrated skill, but this is the most wanted skill also.
Coming back to us in the messages that we are really doing great. Thank you so much. And I'm sure the people, those who are watching it, they can actually connect and relate with the inspiring stories and all the motivation we are bringing to the table. Let's all welcome Vijaya Sen.
Thank you. Thank you, Priyanka. Thank you for inviting me. Before coming to your studio, I was going through the podcast, and the kind of women you have invited in the past, they have really incredible stories and very inspiring. And because I love hearing podcast, and I feel that there is a lot one can really learn from the people's experiences. So I do resonate with this.
Thank you so much for the kind words. Thank you so much. And it's such a pleasure to have you here with us.
Thank you.
You are coming from a different industry, and I'm sure we all are very much curious to know about behind the scenes.
I'll be unstoppable when you start asking me, because healthcare is something, it has become my DNA. I've been into healthcare for more than 2 decades. So I'm quite keen, to explore and understand what you have in store for me so that I can answer them in those ways.
So let's dig in. Okay. So healthcare is one of the most high pressure industries, I would say. But how do you think the HR person or a profession in healthcare is different from the other industries?
This is a very common question when people keep asking me, how HR in healthcare is so different from others. Actually, it is different because there is a lot of things we go through. We are actually not hiring people for their productivity. We are hiring people for clinical outcomes. You name whether you're looking for a nurse, you're looking at how the patient delivery is going to be. If you look at a doctor, you're looking at the clinical outcomes. If you look at a support functions, what is going to be their patient experience? So everything is so much intervened that HR has to be completely sync with the business, what we are wanting to do, what kind of people we want. So we have to understand. And healthcare is a very highly regulated environment. You work under certain scope. This is what you have to get people. You have certain standards to meet. So when you have standards to meet, you have to follow the rules and regulations. Number one, I'm not saying other industries don't follow, but healthcare definitely has a regulated environment under which we function. So that's one. Secondly, the competence level, what we look at is completely different. So the clinical competence has to be highly checked out before you hire somebody. And of course, the HR plays a very important role because we are judging the individual not by their profile, but through the interviews, we try to find out how this person is going to be culturally fit into the organization. So there is a lot to talk about when I say about HR. That's the reason people who join healthcare HR, they really don't deviate from this industry to some other industry. I've never heard that. So whether it is in India or UAE, people stick to it. So that's how I have been in this business for more than 20 years.
Okay. So most of the HR departments don't need a lot of headcount. They need mostly the people come with more courage. Do you agree on that part?
100%, 100%. You know what? As I mentioned to you, our recruitment is not based on how this person is going to be productive at work. We are not looking at it. We are looking at the clinical outcomes of it, the patient experience, whatever we talk about. So we look at the person working in that situation. So the situation is very dynamic. So when you look at HR, it is not looking at filling up the headcount. We will, even though the position can be as urgent as it is, we go through a lot of ethical dilemmas, of finalizing on recruitments, whether it is doctors, nurses, or anybody. But we don't compromise on that because finally this is going to reflect on the other side where it's on the safety of the patients. So when your environment is actually looking at the life of people, you cannot go wrong in your hiring. So the hiring has to be absolutely dot. And secondly, since under UAE law we have 6 months probation period, so our probation period is very tough. We really look at every individual more critically on adjustments, on adaptability, on their clinical outputs, everything we look at it. So the first 6 months in any organization, in any healthcare, we critically evaluate the person before we confirm.
Okay. Coming back to the hiring, I want to understand from you, like, tell me about a hire you championed. You really thought in your mind that this is going to be the best employee or one of the best selection for that organization. But unfortunately, that person completely failed. So, what did that actually teach you about yourself?
Very interesting question, actually, if I look at the kind of selections we do, everyone comes out very good on the papers.
Right.
That's the first way of sourcing a candidate.
And I think this is common in most
Very
of the
common,
industries.
yes.
Yeah.
When they appear for the interview, their communication is fully articulated. They are very clear that this is what, okay, if I have to give an introduction about myself, this is what, since this position is for a nurse in critical care, this is what I have to answer. Okay, you do well in your competency assessment. I'm giving you an example of a nurse. So they do everything very well. But what happens is that it's just not the competency level, it is also about the speed, about your response time in the organization. So when you join, if your speed is not that fast enough, or your response time, your reflections are not strong enough, then because clinical environment is dynamic, as I mentioned to you, so you really cannot see that, so coming back to your question, we had such kind of hire, and not once, many a times. It is very common. That's why I'm saying, our 6 months period is the most critical period for a new joinee to come on board. So we go through this exercise of evaluating the person in the first 6 months. So for me, the learning has been, as you asked, what happens. So learning not only for me, for even the hiring managers, nurse managers and all, is that we look at the behavioral assessments. We don't have a behavioral assessment as such in the objective type, but we ask certain questions which we know that this is a scenario which has happened. How do you respond to that scenario? So that is one. And plus our judgments on that front. So when we evaluate the candidate, it's the panel discussion is there, for that interview. So we look at everyone's opinion and then we recruit. So although this is not so common, these kind of wrong hires, but when it happens, it's a learning lesson for us. And then we make sure the next selection is based on more prudent way of selecting the person on board.
Right. So may I ask you generally how many rounds of interviews you take to get on board someone for these positions in the hospital?
Yes, there is at least 3 rounds of interview. So for the clinical people, definitely there is a competency assessment. So the HR conducts one round of interview, and our HR interviews are not just how soon can you join, what is your salary expectation. No, there is a more to it because we understand the department well, the basic questions about that department because this is what they want. We ask those primary questions and then do the screening. Get this one. So the first round of interview is very important. HR round of interview. Many people get mistaken. Oh, it's a HR call. I can be as informal as well. So sorry if you have been informal. Probably you are not there in the shortlisted list. So we our interviews are quite good. My team follows a certain pattern of interview conduction, and then we have a round of interview which is before we have a interview with the functional head. We do a proper assessment, competency assessment or a written test which we conduct. Especially I'm talking about the clinical side, and then we have a face to face interview. And once a face to face interview is happening, then we take a final selection. We sit as a group and take a final selection on that and issue the offer letter.
Okay. And
That's
does
how
it
it is.
involve any psychometric tests and all?
We don't have any psychometric tests, but I would be keen to have one for my organization. I'm evaluating some people on those grounds because I feel since it is more behavioral assessment, which plays an important role, you have to have a psychometric test. And I personally have gone through the psychometric test way back, say about a decade back. For I it was my personal interest to find out how it works, and it is a very beautiful tool. I think the organization which relies on this part, they should have one structured psychometric assessment program.
Nice. So I'm hearing this word a lot, clinical hire. Okay. So you say every hire in healthcare is almost like a clinical decision. Can you explain what that mean in a real life?
Okay, I have to connect you with an experience, then only it'll make it interesting. Uh, Actually, this is something very interesting case which happened. We hired a doctor, okay? A doctor under supervision. Under supervision means he works under a senior doctor. So he was supposed to follow the certain protocols, and the person came with a good experience, Saudi experience, UAE experience, and all, and required license also. The protocols were very well explained. The orientation was done very well, and we left the doctor to work on its own. So the doctor, when he started working on floor, we found he did not demonstrate the kind of confidence to a patient because here this doctor was also dealing with the patients. His job was to bring patients from the emergency department to the particular department for which he was working. So, when he was meeting the patients in the emergency department, he was giving a certain kind of clinical assessment which was not right. It was making the either the patient very jittery or insecure or feeling unsafe. Unsafe is the word I would say. And secondly, the doctor was also giving certain kind of assessment which was not under his purview, under his scope of services. You know, because he is under supervision, he cannot give certain kind of assessment. Now, these are the things which happens on the floor when I say, because you do a selection on certain ground that you have required license, you follow certain kind of method of selection, 3 rounds of interview, and then when you have somebody like this whose performance is something you cannot control because it is happening on the floor and it is leading to unsafe practices, then we will have to take a decision. So this is something I wanted to connect, that how important is the hiring. So as a HR, when we are bringing the candidates are sourced by HR. So if we give a sourcing based on license and just the basic criteria what they have said, it will not work for our institution, especially in our hospital or any other bigger hospitals who are based in UAE. They have certain standards to meet. That's the reason our recruiters are in house, because we train them the way what is expected from them for the business.
Okay. So has there ever been a moment you almost quit HR entirely, and what pulled you back?
Oh my God, this has come to me so many times I cannot tell you. Despite having that personal interest of working for healthcare, the reason I'll first tell you why I want to work in healthcare, and then I'll tell you the
Yeah.
reason of quitting. The reason I want to work in healthcare is that I know I'm working in a certain ethical framework, that I know this is my job, and this is what ethical working, and you will have to demonstrate certain kind of professionalism in bringing those kind of things to work. But what happens is that when certain kind of ethical dilemmas happen, when you are put in a situation where you have an objective way of assessing certain things, and the hiring manager says, no, I just want to forego all this and want to hire, but I know there is a risk. Because see, when HR is looking at it, the HR is giving you objective assessment, cultural fitment, and third is the risk of hiring. So when the hiring manager is not looking at those areas, that's where you feel really helpless, that despite telling all this, the hiring manager has taken a decision of hiring that person. So this is an hiring kind of scenario which I've explained to you, but ethical dilemmas happen in human resource quite a lot. Example, you come in a situation where you have to get this doctor ASAP on board, okay? ASAP means, okay, the doctor has finished everything with the previous organization and you have to get the doctor on board today only. Now, you cannot get the doctor today only. The doctor will jump on your head and saying that, I have a patient waiting for you. Me, I have to open the clinic. Please, please, please get me on board. Now, I cannot get you on board just like that. I have to make sure my compliances are in place. That is, the medical malpractice is done, the license registration is done, the labor contract is done, and the privileges are done. The most important, when all four of the things are done, then I can get you on board. But this kind of thing, when I keep repeating to the people don't really like it. But then I have to be on the side of the management, because this is my hospital. So if we do anything wrong or anything unethical, or I bypass the steps, it'll only affect my business. So that's what we try to say that. So yes, when it comes to this point, at times when people don't follow the things, you feel frustrated, and you feel that, oh, I'm not going to work, too much I've given them the knowledge, but they are not able to understand. So this kind of ethical dilemmas keep coming to us, Another example I would like to share with you. We had to hire somebody urgently because that department replacement had gone and we could not find the right replacement on board. It was an urgent requirement, and so many shortlisting we did, and we were not able to close it. And it was a clinical requirement, clinical nurse. We had to push that on the grounds that the person was competent, but there was something which we were not very comfortable with. Me and the hiring manager, as a department, we had an understanding this is not a right recruit, but we wanted to give a chance. We said, okay, we'll go ahead and give a chance to it. We gave a chance. Sometimes we are proved wrong, because the way we assess so critically, on flow, the person comes out very different, because the person's cultural fitment is very high, adaptability is very high, and can handle all types of situations. When such kind of things happen, we are amazed. Oh, okay, we thought about like this, and look at what has happened. Yeah.
Okay, that is nice. So what's the one skill they don't teach in any HR course or MBA, but you wish someone had told you early on?
Judgment. Because that is something cannot be taught in any school. They cannot teach you. They will teach you all everything, what is the fundamentals of human resource, the fundamentals of management, but nobody will teach you how to judge a human being, and that comes with experience. And I'm not saying that since I'm the most experienced person only I can judge. I train my team members also. I share those experiences, whatever we go through inside the hiring room or discussion room or meeting rooms, the different kind of ethical dilemmas. So when I have my weekly meetings with my team, I express my experiences, and I encourage everyone to share their experiences also. So we learn through our experiences that this is what not to be done, or this is what to be done, kind of thing.
Okay. And may I ask you, like, how did you get the seat at the executive table? Not just the seat in the room, but actually a person who makes the changes in the decision.
Actually, it's not so easy to go to that C level position, because your 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 formative years or learning about everything a system allows you to learn, and then you're growing up in your career, that you're becoming a manager, you have a team to handle, and then gradually when you come to the C suite level, it's like you're facing the boards directly, and the board, they have less time, but they want a lot from you. So what you have to learn is about how to articulate your communication, how you express your point in a shorter way, or how you do your storytelling to them to express what you have to say about a particular situation. So getting into the C suite is definitely not an easy journey, because you pass through all this thing to become one, and when you reach there, it is not easy to sustain in that role as well. When I said that I worked with my previous organization for 12 years, it wasn't easy, because in C-suite level you are questioned and you have to have an answer. You cannot say that I'll check and get back to you. So you have to answer there and then, and your presence of mind and presence of interest in the business is very important. How connected are you in the business important. If you work within your parameters, that I'm a human resource, I'll only understand about human resource. No, the human resource cannot function on its own if human resource doesn't understand the business. So the business understanding is important, and that's what they look at it in the executive table, that what you bring on board, how you're making a change to the business. Are you really effective on the role? The effectiveness is not about how many closures you did, that is your hiring closures, or your compliances have been great. They are actually looking at it, how much do you understand the business. If there is any discussion which is more about the clinical role or creating a new position, what kind of input are you bringing on the table? That's what a human resource does. So the C-suite level positions are very different from the managerial level, because then you really sink into the business and you understand the business and start working like the one.
Okay. So I have three rapid fire questions for you.
Okay.
Okay. And answer based on whatever first comes to your mind.
Okay.
Okay. So, overrated HR trend right now, one word or one line.
Talent acquisition.
Okay.
Are you looking at the domain, or you're looking at some
In
personality?
general,
Communication.
anything overrated which you think which is overrated right now as an HR trend.
Communication.
Okay.
Yeah.
And finish this sentence. The day HR stops being human is the day dash.
The business will collapse, because the business runs on human resource. They are not machines. So human resource is all about you being there. The staffings are there to run your business, and you can handle any eventualities only human resource can do. So yes, I don't see the business growing when the HR is not there.
Okay. And so one thing every CEO get wrong about their CHROs, and every one thing which every CHRO gets wrong about their CEOs.
Difficult one, huh? I would say that, misjudgment. HR is always misjudged. I'll give you an example, very common to say. We got to know about the salaries, HR is the one who would have leaked the information. Very easy. But HR is the custodian of salary. Why we would leak the information? So it's always a misjudgment which happens, that as a CEO, you may hear a lot of people talking about. But okay, your job is to hear everyone. But at least listen to us. As a human resource, we work as a catalyst between the management and the people. And when you look at it as a catalyst, that means I don't have any say into it. So I'm not going to give my perspective on it. I'm going to give you a perspective from both the angle, and then you take a judgment on that. But if you misjudge me and mistrust me on me or the department, then I cannot help it. So that's why I gave you the example of compensation, because this is whether I worked with A, B, C, any organization, always it is heard, oh, they all got to know about the salaries, the HR must have leaked out. Well, we are not the one who will leak out. Check with others, how did they get it? Maybe a corridor discussion, but the HR is misjudged. That's all I'll say.
Okay. And what is that one thing which CHRO gets wrong about CEOs?
uh, at least as a person, I will say that, oh, he didn't hear me properly. I wish.
In that case, as well, CHRO is on. Okay.
I wish you would have heard. I would have told you, then you wouldn't have misjudged me.
Okay. Okay. So, how do you measure the ROI of culture when the CEO asks you to prove it in numbers?
Numbers, culture. Difficult question you are asking me. But anyways, the culture is assessed by the type of people we get on board, the diversity, very important, because our eco environment in UAE is diverse culture. So when we measure the culture, it is all about whether this diverse workforce is able to function in that department or not. So that measurement is one thing which we always see to it. We encourage every department to have a diversity. And this diversity is also not easy, because once you get a different kind of people who come with different culture, background, language, the first thing, misalignment happens. The misalignment happens in terms of communication, misalignment happens in terms of understanding. So misalignment happens in different kind of platforms, but then this is something we try to measure on the grounds.
So, you have spent a decade in the UAE. So, what do you think that which is one thing which about this reason uh, most of the people should learn in terms of the leadership, which other reason should actually learn? I mean, what is that one thing which this reason is doing in terms of the leadership, which other reason should learn?
Actually, after working in India for more than a decade, and then I moved here, I feel that, the diversity here, it really teaches you resilience, it teaches you adaptability, it teaches you the communication. Because see, if I have to give you an example, in my department I have 4 nationalities working with me. Broadly I'm talking about, you have Indians, you have Filipinos, you have Arab people, and you have Emiratis also. Everyone has a different kind of background, different culture, different languages, and a different communication style.
Right.
So the leadership here is all about managing them, understanding them, and how you respond to them. You cannot be reactive. For instance, it's very comfortable for me to have all Indians in my department, because I can speak in my own language. That's my comfort language, and get my things done. And we work at the same speed and same level of equation. Whereas if you see, in a diverse workforce, the ecosystem changes. You have to work in a very different pattern. Somebody may be slow in reaction, somebody may be fast in action, somebody may not even think about it. Somebody will just give you what you have asked for. So this is something which in UAE is very different, and I really take the pride of having worked here for 15 years, and I hope to continue more. And this place has taught me a lot. This is something I've changed as a human being. I've changed a lot, because your behavior, your conduct, and everything changes when you work in this kind of diverse workforce.
I have heard a lot of people saying that my HR team work more as a police than a partner. So, what is your take on that?
Because we are the custodian of policies. So obviously when we are trying to drive the policies, people feel that, okay, they are talking like a police. They don't have any kind of leeway on their request, because they are coming with a request which they know it is beyond the policy. It's not within the policy, and they are wanting us to make certain kind of changes. So We do as a HR, HR in healthcare, especially I'm talking about. We don't really close the discussion. We understand what is their requirement, and we find a way to address that. If this is not the right way, then we find a different way, and that is what healthcare HR is different, because we are not working from home. We are working in person. We have a personal touch to the people, so we understand what's their question, what's their concern, and try to address it in the best possible manner. And that's what is I find is very different, you know.
Okay. So, Vijay, I want to understand that your balance as a mother, as a cyclist, as a content creator, and a CHRO as well. So, how do you manage all these things?
Actually, my energy level is so high, you know, and I keep thinking that, you know, when will I slow down? It's all about, actually, if you try to manage your time well, because I'm an early riser. If you call me as a 5 a.m. club person, I'm in those category. So if you start very early, you have a lot of time for yourself to manage, and I utilize my the positive energy in doing these kind of things, you know, whether any type of workouts. For me, the mantra is 60 minutes is yours. Whatever you want to do, whether you want to do a cycling, or you want to do a workout, or you just want to go for a nature walk, or even a hiking.
Right.
That's something I love doing it. So 60 minutes is mine. After that, it's all for rest of the things, you know,
Yeah.
the materialistic world where you're fitting in. You want to do this, you want to do that, work wise, professional, personal life. So you can manage everything if you manage your the other activities as well. So it's very important to understand where you stand and how you want to channelize your energy.
So, I'm very curious to understand that. I mean, like, I want to know if what will be your take on that. So, if HR department disappeared from the hospitals, say tomorrow, like, what would patient actually notice?
Your situation is like HR functioning outside the hospital, or
In a hospital? Yeah.
they are not sitting in the hospital, they are
No,
outside.
no, no. I'm not saying as a person, but as an HR, as an operation, the department, I would say.
See, basically, I feel, Priyanka, you're trying to give me a situation where it is completely AI. Somewhat like that. Do you mean that?
Uh, no, not AI exactly. See, you are managing a department, which is a human resource department, and it has a big involvement in a day-to-day lifestyle, how a hospital operates, how it manages everything. So, if suppose that whole entire portion is not there, how you think the patients will see? What would be the impression will go on patients?
There will be a direct impact on the patient, because the hiring will be to the choice of the hiring manager. The way we are, as you mentioned, HR doing the policing part, you know, so we make sure that, you know, as a HR, we bring diversity in certain departments, and we bring those kind of experienced people for them. So if the HR is missing and the hiring is done by the hiring manager, then it will be to the likes and dislikes of the hiring manager. Okay, number one. Number two, the people. First, I spoke about the people, how this is going to create an impact. Now, giving an example of a patient experience, if you give the entire authority to the operations team and say that you bring your team, okay, you don't need a HR, and make sure the hospital functions. So this department brings the team of their choice, okay. Now they are trying to make sure the patient is looked after well, so the patient experience is good. So patient experience can be different, you know, because the touch points are different. The touch points are not as per the standards, or maybe as per the standards as well. So there is no standardization when there is this important function missing. No compliance when this important function missing. No competence check when this important function is missing. So I feel that, you know, I strongly propagate this point that in healthcare, the human resource plays a very vital role. They are the catalyst of the people. management. I'm talking about management and the people. So this catalyst, who's also standing for fairness, this catalyst is also standing for the employee rights and responsibility, and this catalyst is also responsible for the patient outcome, that is your experience, the clinical outcomes, all that. So you cannot really get this function out and then make the department function without a human resource.
Okay, so you have built a talent pipeline, and in a sector where I would say burnout is a crisis,
Okay.
or healthcare industry, I would say, as you have mentioned, it needs quick attention and it needs a lot of attention to detail, and there is a pressure involved in it, which is there, and it is understandable for everyone. Tell me about someone whose career you literally saved and how you did it.
Yes, it's a very interesting question because I have a very good experience about this. That one of my very, very senior most doctor who had worked with the us and with previous organizations also for a very long time, very established career he had, was under tremendous pressure because of the age and other things, but had a huge number of patient following. But he could not really work for a long hours what the work demands. And he came to my office and he said, Vijaya, I'm not able to work for this long. And I know that, we have a standard contract which respects you to provide a 48 hours of working. I cannot do that. I feel that I want to quit this. Now, enough. I had given the enough to the people, but now I want to leave. So I said, have you decided on this? He said, no, I'm just thinking about it because I know for sure this is not manageable, the 48 hours. So I said, well, we don't have anything lesser than that, but I can work out something. But tell me, you could work for less hours? He said, I can work for less hours. I can work for less hours for sure. But if you can see, look at it, it's fine. We never had that kind of contract where we could reduce the working hours plus make the person be available there. So we came out with something very new, spoke to the management, came out something very workable solution where his burnout can be addressed, plus he could continue working with us in his own flexi time. Third, we can provide uninterrupted care to the patient. So we could address everything. So this is something I really played a role to make sure this happens. And after that, we have not looked back. After that, we really got many of those kind of people who are facing this kind of situation, give them this kind of opportunity, working in less hours as well as contributing to the organization.
Okay, so while we are talking about burnout, so burnout is one of the common issues, I would say, in a healthcare industry. So, how, as an HR department, you are actually dealing with such cases, and how you're making that it will go down, people work more happily, and the situation will get be more amicable for the patients, for the hospital management, as well as for the staff.
See, the staffing ratios are very important, That's why I said we work in a highly regulated environment. So, Dubai Health Authority gives a complete standards, to make sure that you have this number of staff for this number of patients. So, there is a patient ratio. So, if you follow those patient ratios, which we follow in our organization, that takes care of your burnouts. Okay, that's one. Secondly, we have a very good standard duty rosters which accommodates people for different kind of reasons. Like we have 12 hours also. If you have 12 hourly work, you will work only for 4 days, then you will have a 3 days off. We have those kind of thing. We have a normal OPD working hours also. So we have customized our duty rosters in such a manner that it is not one standard which fits all. It's a customized one which has several kind of patterns which allows people to pick up those, or the department picks up as per the requirement of the business and provides it. So this takes care of the thing. So we work very closely with the department in designing those work timings, work patterns, and other things. And other than that, we have different employee engagement activities. We make sure that everyone enjoys, participates. Every quarter we have different kind of programs. Like sometimes it is mental health, tuned to whatever is international standards are coming. So we keep having something or the other where we make sure the employees are a part of it, and our preparation goes much in advance. If it is a quarterly program once in March, so we start a program in January. So that's how we do it. So we make sure the people are involved. So you have that kind of personal engagements where you engage employees, and you have your way of working also.
Nice. Okay. So, if you would get an opportunity to give a one line message to all the HR professionals in the healthcare industry, what it would be?
Actually, everybody talks very big things. For me, I would just say, uh, be clear what you want to communicate. And before communicating, articulate your communication, because we play an important role. Although it is the most underrated skill, but this is the most wanted skill also. People think that communication, if I attend different workshops, I can speak anything. But your communication has to be really articulated in such a manner that you give what the person wants it. So every person's communication has to be different. If I'm talking to Priyanka, it has to be like this. If I'm talking to my CEO, I have to be using a different mechanism. So I have to make sure my communication is with clarity and very well articulated. That's the message I would like to say.
Thank you so much, Vijaya. And is there any thing you would like to say to the females, those who are watching it through the platform? Any message would you like to give?
As a woman, I have gone through a lot in my life, and I see many women go through that, from your formative years to this. I have spent nearly 35 years, and I feel that, uh, if you dream, you want to do something. If you're ambitious enough, and your partner, that is your husband or your friend or your family members, support you, then you can really achieve a lot, because you cannot achieve all this on your own. To a lot, I give all my credits to my family, who supported me in this journey from where I started and today where I am. So from a executive level to CHRO, the journey has been long, but it was made more interesting because of my family support. So I would always say that, have their support, be ambitious, and you can do it.
Thank you so much for coming and sharing all the experience.
Thank you.
And it was really a great pleasure to have you here with us.
Thank you so much, Priyanka. Thank
Thank
you.
you.
Pleasure meeting you. Thank you.